big news at this hour. India is truly in middle of a third wave. A lot of the patients who will test positive will be mild, will be asymptomatic as well. And in light of that, government has now come out with new home isolation guidelines for these mild and asymptomatic cases. Meher Pandey joins us on the phone line. Meher, take us through some of the key points over here, please.
Yes, Sonal. So as the government has been saying, and many leading doctors as well, that home isolation will be a key strategy for this Omicron variant, as it is leading to milder disease than the Delta variant, but it is not mild. It can be managed at home, but it needs to be monitored and taken care of very well. This is why the government has now come out with a fresh set of guidelines for home isolation patients. Now, the people who are eligible for home isolation are those who are either asymptomatic or have mild disease. So they will be clinically assigned as mild or asymptomatic by a medical officer. They cannot themselves declare as mild or asymptomatic. And then there needs to be a caregiver who has ideally completed their Covid-19 vaccination, and they need to be in direct communication with a medical officer who will take care of the home isolation patient and keep track of their oxygen saturation and all of the other things that need to be kept on a watch for. There are instructions for the patient. The patient must completely isolate themselves from other household members. This is especially important because we've seen with the Omicron variant, it spreads incredibly fast. Within a family, it spreads very fast. So there needs to be very strict isolation even within a household. So they need to stay themselves in a well-ventilated room with cross-ventilation, but separate from other patients. They should also use a triple-layer mask and discard it after 8 hours of use or earlier. This is actually a 7-page document that is very detailed on every single aspect of self-isolation and also caregiving for a self-isolation patient. The caregiver needs to have ideally completed vaccination. They also need to wear a triple-layer mask and discard it after within a minimum of 72 hours. They need to cut these masks into pieces actually before putting them into a paper bag. There's also a very strict hand hygiene that needs to be followed. And exposure needs to be minimized as much as possible. There is also guidelines for treatment of biomedical waste disposal. That is, of course, accumulated while treating a COVID patient. This is a huge document with very detailed guidelines, really showing how important home isolation is going to be with this third wave.
All right. Home isolation will be key when it comes to this third wave. The details of the document will be available on our website, NDTV.com as well. So do tune in there and get all the latest updates. But like we said, India truly now in middle of a third wave, and these new guidelines will ensure that we do not have more fatalities, and these cases which are recovering at home also are fully monitored.